Yes.
Yes.
I think we are on the screen.
Yes.
Without further delay, we will start. Let's welcome those who are joining our live. We do have Needu Krishna, Needu ma'am. Welcome ma'am. Welcome to our live. Yeah.
Good morning all.
Yes. Yes. There we
So we have just started.
Yes. People are joining. We do have a lot of good news to share with you. As people join by, we will be sharing those good news which will be very beneficial for your future, which can absolutely change their future, in fact.
Exactly.
Yeah.
I think we are here with a bucket of happy news over here.
Yep.
It's not only one.
Yeah.
So we have to wait a bit to join. So we have to give some time for our students to join with us.
Exactly. So, yes. Okay, I think let's share the good news that we have to share. So the first good news is that on 23rd of this month we have a German recruitment drive is coming up for all the nurses and those who are completed just 12th as well. This drive is gonna be held in Kottayam, so we will have a glimpse of it in our live. There will be a video playing in, so we can have a glimpse of the representative who are taking the direct delegates who are coming in to take this interview from Germany as well.
Exactly. So
Yeah.
I just want to mention that try to utilize this moment or this opportunity as good as enough, because it is a direct interview from the delegates from Germany.
Yep.
So it's going to be so beneficial for everyone. So don't miss this opportunity as well.
Don't forget the date. It's on 23rd, and this will be from 9:30 up to 4 o'clock.
Yes,
Please
sir.
be on time with the require equipments and required documents as well.
Okay.
Fine. Another good
Yeah.
news is that very recently we got OET results published. So what was our result?
I'm really proud to say that as a trainer, it's really glad and it's a really happy moment to reveal the result over here.
Okay.
Yesterday we got the result after last month exam. It was so surprising, not really surprising, but it is so happy to say that
Yep.
we got 200 plus good result.
Exactly.
I just want to mention that most of the students got A grade
Yeah.
and most of them got full B.
Full B.
And it is really proud to say that we are running with good results and our students are really satisfied with that.
Okay, by seeing this result, I would like to congratulate all the trainers who put their, their effort into this and made this outcome for AJINORAH. So, as a proud AJINORian, I would like to tell everyone, those who wish to study OET or IELTS, please do join us. We do have good number of trainers and we will be providing, lot of things that will be beneficial for your future.
Exactly.
So the outcome of it is the results. Okay, you are seeing a glimpse of it right now. These are the results. Those came just day before STD.
Yesterday. And it is shown that it is B, A grade. I'm really
Exactly.
happy to see that in the
Okay.
monitor actually.
Fine. And another good news. What is that?
Yeah, it's something really great. We got the results of the nursing students at yesterday, before yesterday it is published.
Okay.
And as AJINORAH, it's a proud moment that is something really to be celebrated because moreover that I really want to reveal this glad news over here because I'm a nurse by profession. Yeah, we got the result of BSc Nursing. All the students in AJINORAH joined is passed with the exam. So we celebrated in each centers of AJINORAH. We cut the cake, everyone gathered, and it was a celebration in AJINORAH. I'm really happy to congratulate all the students who got the results of their degree, and you are graduated as a nurse now.
Okay, we'll have a glimpse of the celebration that we had yesterday in our institution. Cleared their nursing, although they got registered as a nurse in fact.
Yeah, sure. So I think it is clear with the channel, with the link, and it is, yeah, you can see the number of students who received the results, and we have celebrated with the cake cutting.
The students who you are seeing in the screen got registered as winners because they cleared the flying colors. Yeah, we would like to welcome each and everyone who joined us. Sir, welcome and welcome. Good morning to all. So, without further delay, I think we can just move on. Am I right?
Yeah, sure.
Okay. Fine. So, as we are jumping deep into the sea of OET,
Yes.
we have a subtest by name OET Speaking. That's the main content that we are expecting to deal with. The entire speaking topic will not be dealt today, but the beginning and the proceeding of the initial part of speaking. Am I right?
Yes, exactly. It is something really good to discuss because, because it is really important to get to know how can we start with the conversation and how to actually proceed with that, how to progress our conversation. It is something bit confusing always.
Yeah.
So I think this gonna be so beneficial for you, and I really request all my students to take down the notes because it's a class. So try to keep the notes with you and just note down all the relevant points from this slide. Okay.
Please keep that point in your mind. Please take your notebooks and write down the notes. Consider this as a class that we are taking for you. Okay. We welcome everybody. Lakshmi S. Pillai, Renju Alex, please join us. Thanks for joining us in Facebook. As you must have seen the poster, the topic was starting and proceeding role play effectively in OET. So when we were discussing this, or when we were preparing for this live, we were saying everybody starts this speaking role play by saying the criteria. Should we go for that? Then I made a suggestion that everybody knows which are the criteria, the subdivisions, everything. But it's so important to recall to their mind which are those. So as a result, we are just telling. So which are the criteria that we know?
Yeah, I think all my students are well known about that because it is in detail. We have gone through the class about the criteria because as a trainer, I'm telling you guys, you should know about the criteria. Then only you can construct or you can schedule your you are speaking according to the criteria. Then only you get the required score. Okay. So
we are discussing about the starting part of the role play. We are seeing a patient and we are sitting before the interlocutor and we are considering the interlocutor as a patient. So how to start the role play in different settings? So as we know, we have two criteria. Which of these criteria is assessing the beginning part of this role play?
Yeah, about the criteria, I will go with the very basic. Is that fine?
Go for it.
Okay. So the criteria is mainly divided into two. The first one is linguistic criteria. As you know, and the second one is clinical communication criteria. Okay. So linguistic criteria, it is to assess your English speaking skill or your language.
Yeah.
Okay. Then the second one is clinical communication criteria. It is to assess your ability how you are communicating in a clinical setting. Okay. So obviously today we're gonna discuss about something regarding the introduction and the interaction with the patient. So definitely it will be coming under the second criteria is clinical communication criteria.
Okay. Fine. So under this clinical communication criteria, we do have sub-criteria. So among that, which one will be assessing the beginning or the initial part or the introductory part of a speaking?
In clinical communication criteria, there are sub-criterions are there. One is the relationship building, second understanding, incorporating patient perspective, then information gathering, information giving, the last one is providing structure.
Okay.
So the topmost criterion under clinical communication criteria is relationship building.
Okay.
So today we're going to discuss about the starting and how we are progressing our role play. So definitely it is under the criterion that is relationship building.
Okay. Please do remember what ma'am just told you, relationship building, that comes under clinical communication criteria. Under that, we take or the OET assess your introductory part. Okay, fine. So let me ask you, under this relationship building, we do have another sub-criterions, which goes initiating and interacting appropriately. As we are getting a patient, initiating a conversation. Ma'am, for example, I am meeting you for the first time.
Yes.
I must initiate a conversation, or I
Yes.
must start a conversation, and I must interact with you appropriately. So just understand it that way. The patient who is before us is not known to us. First time you are meeting, how you are going to initiate that speaking, how you are going to start that speaking, and how you are going to interact with them. So do you want to state with an example?
Yeah, sure. So we will, if we are meeting for the first time and you are unknown to me, definitely we have to start the conversation as something new.
Okay.
Am I right?
You're right. You're right.
So if you are my patient and if I met you in the emergency department, I'm
Okay.
just setting an example, okay? So we got to start the conversation like this. Very good morning. My name is Varna. I'm one of the registered nurses working in this department.
Okay.
For better communication, may I know your name, please?
Okay.
Or we can go with it directly as what brings you here today, then go with the name. Okay.
So this is how we start or initiate and interact with the patient. This should be, this can be considered as the introductory part or the welcoming part of an OAD speaking. Am I right?
Yes.
Okay. So under relationship building, we do have, it's just when you are taking down notes, put a bulleting point and write down initiating and interacting appropriately. Initiating and interacting appropriately. That's the first bulleting point. So understand it in your own way. Don't make it too complicated. It's all about how you are starting the beginning of it. Okay, fine. The second one, let's put the first bulleting point as A1. Let's see the A2 one. What is A2 or the second one? Okay. What is that, ma'am?
It is demonstrating an attentive and respectful attitude.
Okay.
Okay.
It's demonstrating and attending it in a respectful manner. For your understanding, I'll simplify it. In certain hospital when we go, certain nurses are very rude, but majority of them are like angels. But certain people, those who are very experienced, when they have become injured, they have to be a little rude. So their behavior or towards a patient whom you are seeing first may not be so appealing. So that should not be the case when you are for OET speaking. That should not be the case. So it's like attending and respectful attitude towards the patient. Now the patient is the interlocutor, okay, the OET, and how you will have an example for that.
I'll go for something related to the pain. Okay, so sometimes the patient is extremely exaggerating about their condition. We know that it is so mild and we are doing all the medication and all the management, but still the patient is complaining about the pain. I'm just taking about the pain, okay? See, and the patient is telling that, see nurse, I'm really concerned about my condition. I think that I'm gonna die soon. I don't have any relief from my pain. I'm taking all my medications, so and so. Okay. But there is nothing to be alarmed about, but he or she is really worried about his condition. Okay. But as a nurse, we don't have the right to judge them. We have to respect their concerns and attitude. Okay. Just tell them that, okay, it's quite common. Try not to worry. We are here to help you. Kind of reassurance should be given over there.
Okay, fine. I do understand. That was a second point, and you got an example for that, ma'am. Put it in a nice way with the example of a pain. So almost a patient is saying, I'm going to die. He may have just a leg ache or a back ache. He say, I'm going to die. That's exaggeration. So it's like you should not be judgmental. That's fun. That's a third point that we are going to mention. First was initiating and interacting appropriately. The second one was demonstrating or attentive and respectful towards the patient. And the third one is adopting a non-judgmental approach. So it can be joined with the previous example that you have said.
It's something really important. I always tell to my student that you should not judge your patient words. Okay, so it's something we are always doing some kind of role plays regarding smoking or alcohol. So we have to suggest or advise our patient to quit that. Already we mentioned that we have to respect all the words, right? But we really can't respect this kind of habit which is the patient is taking, because it is really unhealthy. Am I right?
Yeah, you are right.
Yeah. So going for the smoking, so if the patient is telling that, yes, I do smoke 20 cigarettes per day, so don't show that, oh, I got 20 cigarettes. Okay, it's a kind of, you are like you are focusing that it's something really bad the patient is doing. We know that it is not good and it is bad, but don't show that as in a rude way or it is as so negative way. We have to construct our words in a so polite way. Like kind of, I know it is hard to stop your smoking habit in a bit of time or in a short time. Try to reduce the number, kind of words. Okay, so kind of convincing words should be given over that.
Yeah. Basically what ma'am was saying is your words should not cut them into two. That's in simple words. You should not cut them. So it's a proposal that you make to them for their good health. You know that smoking is not a good habit. It's harmful to health. You want to tell this to a chain smoker. When you say this statement to them, that may not be so appropriate. Being non-judgmental, meaning to say, you are saying, I know that you smoke 20 cigarettes a day, but still it is highly advised from the part of medical science that since it is very harmful and it will not be good for you, as a result I am requesting you to cut down the number of cigarettes that you are taking now. I promise you that that's gonna be very helpful and it will increase your health that you're having right now. So we put it in very polite way, being not judgmental. We can be judgmental. You know that this cigarette smoking is very harmful, then why are you smoking? We could ask that, but that's not the way of dealing it.
You should not ask that.
Okay, so that's how we put it. Okay, fine. We got 3 bulleting points now. Let's put it the 4th one. It's showing empathy and feelings. Showing empathy towards the feelings that they have. You know, there are two words, empathy and sympathy. These two have a different meaning. People do
very drastic meaning.
Very drastic meaning, exactly. Sympathy means, ma'am got a cut on her hand. Then I say, oh, I'm so sorry to see that. Then I walk away. That is sympathizing.
Sympathy.
I am sympathizing with this ma'am. Okay. Empathy means when she gets a cut on her hand, I'm dressing her, I'm consoling her, taking her to the hospital, I'm getting into her shoes and doing her father what her father does or mother does. It's being with her and doing what is necessary, joining with her her pain and doing what is necessary. That is empathy. I hope you got the difference. Sympathy
simply we can say that you are feeling their pain and you are involved in their pain. So we are just thinking that yes, it's happened to me, so what are the things we are expecting and what are things we would like to receive from others that we are doing to them.
Exactly. In empathy, your pain is my pain.
Yes, exactly. Simple.
In sympathy, her pain is her pain, my pain is my pain. Okay, that's so simple as that.
So shall I cite an example for this?
Please
I'm not going for any kind of example. I will cite an scenario over here. Is that fine, sir?
Please, go for it.
Okay. So I always go for my students that we are talking to our patient, not only to our patient, we have to talk to the third person, which is bystanders. Okay. If you are talking to the third person, it is something really to be concerned about and really to be conscious about when you are talking. Okay. Because they are not affected with any health condition, but their loved one is really affected with something. Okay. So they need something as so convincing. So if you are talking to the parents, especially for the parents, okay, their son or daughter is affected with something and they are here for the help. And if you are talking to them, try to give more reassurance and more empathetic words about that. That's a scenario which in this is coming under.
Okay, I do understand what you were saying. That was put in a good manner. So we have covered just 4 bulleting points. I hope you got it. For you, we will summarize it once again. Ma'am, what was the first one?
We have discussed about the relationship building. See, I always when I take the booster class, I will tell my students there is one tip to be followed to get a good score for the clinical communication criteria. I have mentioned about the 5 criteria criterions under this clinical communication criteria. The relationship building, if you are maintaining that or if you are focusing that, definitely all the criterions under the clinical communication criteria will be met. Okay, because we are talking and we are maintaining a conversation. Definitely, if you are talking, it is under what? If we are talking, we will be completing the information we are giving, right? So it is we are completing that information giving, and when our patient is talking, it is information gathering. Okay, definitely they're gonna talk about their concerns. So that is a second criterion, that is understanding and incorporating with their perspective.
Okay.
Okay, and everything is organized one by one. So we have to follow the order. So it will not be a problem for that.
Okay.
So for just following this criteria, we can meet all the criterion under this clinical communication criteria.
Okay.
Okay. So I'll just read out this A1, 2, 3, 4 to take on the notes.
Sure.
The first one is initiating interaction appropriately.
Yeah.
A2 is demonstrating an attentive and respectful attitude.
Okay, and the third one is adopting non-judgmental approach. Adopting non-judgmental approach, and the fourth one is showing empathy for their feelings that they have. Okay, those were the 4 bulleting points. If you have any doubts or queries, any concerns, feel free to comment below, whether it is in Facebook or in YouTube. Please feel free to comment below. We will be answering to the questions that you are asking. I hope that will help you to get a better understanding of OET speaking subtests. Okay, so we had just segregated our life into 4 or 5 parts. We are moving the first introductory part, and the second one, as we have said, the bulletin points, and we are moving to the third one. Okay, the third one is that, I'll put it in a simple manner, the setting or the scenario. Each role play do have a setting or a scenario. This setting and the scenario will affect your introduction. Am I right?
Definitely it will affect your interaction.
Okay. The scenario of a home visit, or a setting of a home visit, and the scenario that is happening there will always affect how we are going to start the introduction with the patient. Am I right?
Yes.
Okay.
You're right.
So it's like you will have different kinds of patients, right? You will have different kinds of patient, like inpatient, new patient, existing patient. All these can differ, right? Okay, fine. So this is like another scenario is that you will have 2 types of patients: known patient and unknown patient. You must be very familiar with these 2 words: known patient and unknown patient. Okay, ma'am, do you want to make a comment on that?
Yes, sure. Because as already sir mentioned about non-patient and unknown patient, we are always separating, or we are always marginalizing, or we are always dividing the entire role play into these 2 categories. Because we do have only 2 people, that is we are known to and we are unknown to. Okay, so in that I can mention about which is non-case. It is some patients are included at inpatient and existing patient.
Okay.
Okay. And if it is unknown patient, it is a kind of patient that is new. You can call us new patient. Okay. So for non-patient, the way of introduction will be something really different, rather than communicating with the patient is unknown.
Okay.
Okay. So do you have an example for that?
Yeah, please. You can state that as well.
Okay. So if it's non-case, I will go for the setting of a hospital ward. Your patient underwent a surgery, kind of neoplasty, and he is maintaining good progress as well. So we are here to know about the current health status of our patient. Okay. So we know the patient. Okay. So during the 3 minutes preparation time, we have to ask the name of our patient. It is really important.
Yeah.
Okay. So the introduction will be like this. Very good morning, John. As I know that I'm your caring nurse, I'm Varna. How is your day so far?
Okay.
Kind of. Then go with your first task.
Yeah, this is an interaction that we can have when it is a non-case.
Yes.
Right? So this is a case, the patient. So as a result, this patient is familiar to you. So when you know, you could just non-patient. You could ask like, I know this ma'am before. Then I will not ask what is your name at first. Right.
Yeah.
So simplify it. That's how we do it. Okay. Fine.
And shall I go for unknown?
Yeah, you can go for
Okay.
unknown case. I don't know this ma'am, but in a simple way, I don't know this ma'am. First time we are meeting, or first time we are meeting a patient. How we will begin with?
Okay, so I'm considering Vipin sir as my patient. We are meeting in kind of clinical emergency department as per the setting. Okay, so my introduction will be like this. Very good morning. I'm Varna, one of the registered nurse working in this center.
Okay.
How can I help you today?
Okay.
Then after that, go for the name. Okay. For the documentation purpose, may I know your name, please? Or you can ask after our introduction. I'm one of the registered nurses working in this clinic. What's your name? Or how can I call you? Or how can I communicate with you? What you kind of?
Okay. That's how we start with unknown patient. She introduced herself and she said, I'm working such and such, I'm a registered nurse working right here. That's the introductory part or a basic info about her. Then she is asking, now, how can I help you? So let's simplify it.
Okay.
Fine. So when we said the first bulletin point, you remember the bulletin point. The first bulletin point was initiating and interacting appropriately. Initiating the conversation and interacting appropriately. So how to do that? There is a procedure for that. First, what can we do about it? What will be the first?
Yeah, sure. As I think that I have shown a couple of examples over here.
Yeah.
So the first thing what I did is greeting.
Yes.
Yes. Good morning, good afternoon, whatever it is. Try to greet your patient, but there is an exception case.
Yeah, there is an exceptional case. So which is a setting that there is an exceptional case.
If it is just examined case, never go for greeting. Okay, because definitely you have done with your introduction, your greeting, then you have examined your patient. It's a kind of a step or it's a kind of a conversation that we are continuing, kind of a middle portion. Okay, so never go for that good morning or good afternoon. Go for thank you for allowing me to access, or just start your conversation with thank you.
Okay. I hope you got that point. It's like I came, I met the doctor or nurse, I met the nurse, and nurse examined my wound, and after the examination, we are starting the role play. So some things happened prior to that. Now the conversation or the OET exam starts from the middle. That's why ma'am said we will start with thank you for allowing me to assess. Okay.
Or examine whatever it is. Okay.
Fine. So first is greet the patient. The second one is
introduce yourself.
she introduced herself. I am 1 hour again. She introduced herself. Then
Clarify patient's name actually.
you will ask the patient, please may I know your name. That's we are clarifying the name of the patient.
Then clarify your role in their care, which means kind of I'm here to take your vital signs, I'm here to assist you, kind of whatever it is. Okay. But if it is non-case, just cut on this, clarify patient's name, because you have asked or you are well known about your patient's name, so cut the step, go for the next.
Okay. Clarifying the role in the care. Why? The purpose of the visit of nurse, why are you here? Okay. That will be the answer that she will be giving. She will be saying, I am here to take your vital sign, the purpose of her visit. And the last one is nature of other interview.
Okay. So it is nothing but it's nature of interview, that is all the tasks we are inputting in our role play. So according to the task, we have to ask question, we have to put for reassurance, kind of. So it is all about the task.
Okay, fine. So I hope you got it. There is a chronological order that we followed: greeting the patient and introducing yourself, then clarifying the patient's name and clarifying the role and the care that nurse comes in, and the nature of the interview. If it is a home visit or if it is in a any other setting, you must go accordingly. That's the last bulletin point. Ma'am, there are different settings, right?
Yeah, sure.
So which are the settings that can come under non-case and which are the settings that can go for non-case?
We really can't say that this setting will be perfectly non, this setting will be perfectly unknown.
Okay.
I always mentioned in the live that if you want to know about whether it is a non-case or unknown case, you must go for the setting, the background and the first task. Okay, then only you can identify whether it is a non-case or unknown case. But as assessing some kind of settings and scenarios, we get to know that probability or kind of high chance of getting this particular setting is non-case and unknown case. But I'm not telling that always this setting will be non or unknown. Okay, according to the setting and according to the task, it's going to be varied. Okay.
So basically what ma'am said is that Varna ma'am, and we've been told in the live, hospital ward always comes under this or emergency department is always a non-case. No, not that. Okay. It varies. It differs from task to task.
And so sometimes students are saying that if the first task is find out, they are telling that it is unknown case and it is confirmed it is non-case.
No. Don't have such misconceptions. It's not that way. It's not working that way. Unless and until you read through the task and unless and until you read the first bulletin point in your task, you are not going to understand what exactly it is, whether it is non-case or unknown case. So, but still there is a probability, high probability. So if it is non-case, what can be the probabilities? What are the probabilities?
Probability it is hospital ward, then home visit. Home visit always will be non-case.
The exceptional case.
Yeah,
Okay.
kind of exceptional. Home visit because we are going to hand home.
Yeah.
We are going to head home, and maybe we are not able to identify this is my patient, but we know that this is why we are going for that, right?
Okay.
Maybe we are not to the hospital or the center. We are going for the first time to meet our patient, but I know whom I really want to give the care.
Yeah.
Okay, so it's a non-case for me, but we need to clarify whether I'm talking to the right person or not for the home visit.
Yeah.
We'll come to that in detail. Okay.
So-
Then for unknown case, it could be what? Emergency department, some kind of clinic,
Yeah.
and community health center can be both known and unknown.
Okay, please keep that in mind. That's an exceptional case. So, community health center will come under non or unknown case.
Unknown
It can
case.
be both. Is there any other exception like that?
Yes, school health clinic or school health,
Yeah.
then clinics, private clinics, kind of, and emergency department also can be known or unknown. Just because something happens like this, they are here to receive the result, or they are going through the IV infusion or some kind of blood transfusion. They do have the concerns regarding that.
Okay.
Even though it is emergency department, we are done with the IV infusion. It means that we assist our patient, right?
Okay.
So it's a non-case. So
Okay.
emergency department can be known and unknown.
Okay, fine. So, okay, I hope that point is very clear to you. So basically, the idea is that don't have misconceptions. This setting will come under unknown, or such setting will always come under known case. So don't have such a misconception. Please read through the setting, read the first bulletin point. There you understand the patient is known or unknown. So I hope that part is clear to you. I think we can move to the next part.
Yeah, sure.
Okay, we are almost halfway through. Okay, yeah.
Yeah, so we discussed about non-case and unknown case, the department or the centers or the settings. So now I just want to not categorize, kind of categorize. Okay, like kind of conversation we are doing. Okay. We can, as I said, that we are not only talking to our patient, we are talking to the third person also.
Yeah.
Okay, so we can separate that into patient and bystander or third person. Okay, it is better to go for third person. Okay, so if it is person, it can be non-case and unknown case. So the kind of introduction I think that I have mentioned just before. So do I want to go for one more?
Just mention that in a gist you can say if a patient is if the patient or the parent, the person, we are speaking about persons, okay, persons, and if it is a person, there is a high probability of can be around 70 or 80%. It can be a third party, right?
Third party.
Okay, it can be a third party. The bystander is a third party. Patient is lying in the bed or patient is in ICU, and the nurse is speaking to the bystander. That means he is a third party, but they are speaking about the patient who is in ICU. I hope you got that point. There is a question there. So very often our students do make mistake. Wonderfully, they will start the role play.
Yes.
They will proceed with it. Towards the end, they will come and call the bystander the name of the patient.
Yes.
Then and there, you are going to lose your marks. And
Maybe they're going to do completely as a good way, and at the end of the role play, they're going to tell that, okay, I wish you speedy recovery. Okay.
Gone. Then there it's gone. Okay.
So it's a kind of not gender change, your subject is changed actually. Okay.
So your subject is always the patient who is in the bed or who is at home, who couldn't come to the hospital. So keep that in mind. You are speaking for somebody else. Towards the end, please don't say that I wish you a speedy recovery. Or if the name of the patient is Joseph, don't say that Joseph get well soon. Don't say that. Okay, you are not speaking to Joseph. Okay, I hope that point is quite clear.
Yes. So I think that, but there will be a bit confusion. So I always go for that for my students, that try to ask the name individually, because if it's a non-case, okay, if it's a non-case, the bystander is a non-case and the patient is not bystander is a non-case. If you are non to the bystander and the patient is non to you, during the 3 minutes preparation time, just ask the name of the person whom you are talking with. Okay, no need of asking your patient's name. You can mention with the relation, your mother. If sir is my bystander of my patient, so I just want to know only your name. Okay, then I can mention that Vipin, your mother, your father, your child, kind of.
fine.
Okay.
Okay, fine. So, do you want to give a proper introduction for them to write down?
Yeah, sure.
If it is
So,
bystander.
if it is bystander, so already mentioned, I just mentioned about the patient, how we used to start our introduction with a non-case and unknown case.
Yeah.
So now I'm going for bystander, so the third person. Okay. I really don't like to say about bystanders. I just want to say about the third person. Okay. So third person, if it is non, you can go for, sorry, if it is unknown, you can go for that like introduction like this. There is no change in introduction. Okay. Very good morning.
Yeah.
I'm a registered nurse working in this center. My name is Varna, or you can call me Varna. Or I'm Varna. I'm one of the registered nurse, kind of.
Okay.
Or I'm going to assist you today. There are different ways to start your introduction. Okay. So
Maybe mention one of them.
okay.
I am.
Okay. I'm Varna, one of the registered nurses working in the center.
Okay.
Or my name is Varna. One of the registered nurses working in this center, or I'm going to assist you today. You can call me Varna.
Okay, that is a proper way of starting. It's like to an unknown. So the bystander is coming, the patient is unknown to you. So in that case, you could just introduce yourself and mention the job role that you are putting in, and next ask why are you here, or go, how could I help you?
Yes.
Okay, fine.
See, it is perfectly known when you are reading the task whether it is a non-case or unknown case. So you know that you are talking to your bystander, right? So always go for better communication. May I know your name, please? Okay, because students are asking for the documentation purpose. May I know your name, please?
Okay.
It is not wrong really, but documentation is so relevant or something really specific for the patient,
Okay.
right?
Yeah.
So it is a relevant data for the patient.
Okay.
So for bystander that we are talking, there is no need of any documentation. So not much of value with the documentation. It is for the communication. Okay.
Fine.
So on that perspective, go for better communication. May I know your name, please?
Okay. So along with the scenario that ma'am told, there can be parents coming in, right? Am I right?
Yes.
Am I right? Parents coming in. So there can be son or daughter is present. Parents are a patient. Parents are considered to be patient. A son or daughter is there. So how would you just say that?
Okay. Before moving to that, I just would like to mention about if it is non-case. Okay, bystanders kind of.
Yeah.
Parents are there. As sir said, if you are talking to parents, you should be more conscious.
Yeah.
Okay, because they are really concerned about their child's condition. And if it is son or daughter, it will be given. The age will be given, and the son or daughter, the gender will be given. I personally prefer to go with child.
Yeah.
Because in the rush or in the tension, they want to change. The son going to be daughter at the end, and daughter going to be son at the end. So better to go with your child. Okay. And see, like this, if it is clearly given in the background,
Okay.
they are present along with the son, or the son is presented with them. Okay. Or the son is the child is not presented. Okay. If it is not presented, you can go for the introduction what I mentioned about for better communication. How may I call you? How may I address you? Kind of.
Okay.
Or the son or the daughter, the child is present with them. We can start like this. I can see you along with your child. How can I help you today?
Okay. Fine.
Okay.
So please keep that in mind. Please don't shuffle it up. But what you could say is, if the if the parent is present and child is not present with them, it will be very clearly stated where in the paragraph that you will be getting, child is present or child is not present with them. It will be very clearly stated. So don't get shuffled. So should we?
Yeah. One more thing I just want to mention. For the parents, I already mentioned that they will have more concern, right? So if the child is not present, you can go for one more different introduction like this. From your facial expression, it is clear that you are really concerned about something. How can I help you today? Or may I know the reason for that?
Yeah. That's a different way of presenting it. So from your facial expression, from your face, I could make out that somebody has hurt your feelings, something is hurting your feelings. Please may I know the reason. So these are the ways that we could put forward. So should we go for, so before that we will say some good news that we had coming up on 23rd of this month. We are having a German drive coming up for the nurses, free recruitment drive 25 coming up in Kottayam. So, and it's gonna be in Kottayam branch. It's a direct interview from the clients, those who are from Germany. This will be happening from 9:30 onwards on 23rd up to by 4 o'clock. Okay, you can utilize this opportunity. It's the best opportunity that you have. Okay,
And I really wish all the best to everyone.
okay, fine.
Okay, so we'll come back to our topic then.
Okay, sure.
Okay.
Another setting.
And
We'll
as
see
this
another
setting, and see, I mentioned about the bystander or the third person. There is, if it is none,
Yeah.
okay, if it is none, there is two possibility of being of the setting. Okay, see, it is per something really planned or something as per request. That is, we know that the bystander is coming to meet us for some kind for regarding some kind of concerns.
Okay.
So it is per request, and we know that we have to make a conversation with them.
Okay.
So after introducing ourselves, after starting for greeting your introduction, then you can start like this. Like we know the name, right?
Yeah.
We know the bystander's name.
Yeah.
So just assume that it is Vipin. Okay. See, Vipin, I get to know that you have requested for a chat with me. May I know the reason?
Oh, fine.
Okay.
That's a way of asking it. You could just ask. You know, the hospital informed me you would like to talk with a nurse. So I'm a nurse. I'm here for you. Please, may I know the reason why you asked for a chat? Okay. That's a simple way of putting it.
Or something as spontaneously, kind of, we have just done with the discussion or just assessed or kind of, we don't know that they really want to talk with us, something spontaneously or something unexpected. Okay. So it is not it is not according to the plan or without plan. Okay. So kind of this, just ask, okay, Vipin, okay, what's really bothering you, or how can I help you? Or I think that it is something that you really need to be clarified. What's that then?
I'm here to help you.
I'm here to help you.
So simple as that.
So simple.
Okay, we'll go for another setting.
Yeah,
okay?
sure.
I hope we are on the same page. Okay, this is a common usage that they use. No, I hope you are with me, or I hope we are on the same page. Okay, so we'll go for another emergency ward. In an emergency ward, how will you start an introduction in an emergency ward?
Okay, emergency ward should be something short and very sharp. Kind of crystal. Okay. See, because it is something that is something having seriousness or other, so we don't have to tell that I'm so and so, kind of very brief. No need of that. Okay. So go for very sharp and short. Okay. Very good morning. I'm Varna. I'm a registered nurse here. How can I help you? Okay. Fine. Okay, the thing is, again, directly go like this. After your introduction, you can ask for the documentation purpose or for the better communication as per the scenario. Okay. How can I call you, or what
brings you here today?
Kind of. Okay.
What brings you here today? I'll ask like a question. It's a question attributed to those who are present in the emergency department. What brings you here today? Okay, fine. So name of the patient. There is a documentation part. How will you put it?
If it is a documentation part, I will go for this. For the documentation purpose, may I know your name, please?
Okay. For the documentation purpose, please, may I know your name?
Please.
So, okay, fine. So,
the thing is, my students are asking, ma'am, shall we go for the reason of the visit? Then shall we go for the name? Okay. It is a good way that I have just started the couple of introduction like that.
Yeah.
How can I help you today? And what's the reason for your visit here today? Then go for the name. Totally fine. But the thing is, there is a risky part in that. Sometimes after starting conversation, you're gonna give definitely there will be concern, right?
Correct.
The first answer will be the concern or the reason for the visit. Okay. So you will go for the reassurance and you're gonna continue role play. You will forget to ask the name of the patient.
Correct.
There is a chance of that, but if you do have the confidence to continue with that, go for it. That is the best way to start the emergency department conversation.
Yeah, you're right. Okay, fine. So, is there any other introduction that you want to put forward for emergency ward, or we are done?
We are done.
We are done with it. So, we discussed about emergency department so far. So, we said different introductions and the documentation part. and ma'am already said, hi, good morning. I am Varna, a registered nurse in the ward. Okay, what brings you here today? That's a general way of introduction.
I can also mention like this. I'm assigned to take care of you today.
Yeah.
What's your name, or how can I help you today, or what brings you here today? What bothering you today? Kind of lot of things that.
Thanks. It's put it. There is no specified way that you could ask. It's a spontaneous in an emergency ward. So another law of confusing part coming in. It's home visit. A nurse who is working in a community health center going to a home, visiting a patient who is taking rest or who is present in their own home. So they imagine, actually students imagine, they are going and standing in front of the door, putting the calling bell. Then they ask what to ask first. Okay, they ask what to do. Exactly, there is a lot of confusion between OIT students.
I think students are asking minimum of 4 or 5 questions. I don't know, because they are thinking that like we are training like that. We have to be so natural with the speaking, and they are imagining that we are standing there with holding our hands, and we are we are done with the calling bell. We are waiting them. So no need of asking a couple of questions.
Usually people ask a lot of questions. Is this Peter? Is this Peter's home? Am I speaking to the right person? Are you okay now? Can I come in? May I take the seat? So, a number of questions are being asked by our students. We could just summarize it in just 1 or 2.
Two sentences or two questions. Okay.
That will be sufficient. Which are they? The first one can be.
Yeah, sure. Because I just mentioned that always home visit is a non-case. Okay. Like, it is always better to confirm whom you are talking with. Not need of confirming it is a particular person's home. Okay, we need the patient, right? Okay, so we can go for, am I talking to Peter? Okay. Then there will be a specific reason why you're doing this home visit. Okay, there will be a specific reason. Kind of simply we can say that is purpose. Okay, go for the purpose why you're here today, and just ask is the right time or not.
Fine. That's it. Just
do you want an example for that?
Yeah, we could. First and foremost, you understand what we were discussing. We simplified it a lot, so there is a chance for confusion. Please don't ask too much questions when the setting is a home visit. May I come in? Am I right speaking to Peter? So is it the right time? So don't make it too long. Simplify it. You could confine it into just 2 questions. That's what ma'am said. Confirm the patient. Don't ask for home, right, and it's not necessary. You can ask, but not necessary. But you just ask confirm if the patient is right and is the right time to talk to you. Am I right? Do you give an example?
See, if the scenario is like this, patient underwent a total knee replacement surgery, and we are here for the redressing.
Fine.
Okay, fine. So it is like this. I always mention that. Okay, we'll go with like this. Okay. Very good morning. I'm Varna, one of the registered nurses in this community health center, or I'm a nurse in this community health center. You can call me Varna. Then we gonna ask it. Am I talking to Peter? Or you can directly ask, am I talking to Peter? Then you can go for the introduction. Fine. That also fine. Okay.
It's up to the Peter to say, please do come in and take your seat. If the interlocutor says that, accept it and go for it. Otherwise, there is no worry at all.
Then you can go for it. Just we are done with the introduction. We confirmed whether we are talking to the right person. Then mention that. Okay, Peter, you recently underwent a surgery, total knee replacement surgery, and I'm here for the redressing. Is it the right time? You're done.
So simple as that.
So simple. Okay.
Fine.
So see, if something is mentioned in the background, try to utilize that point. What I said just in the case of parents, if the child is present, it is given that the child is present. Okay. So this is that is something relevant to be about this particular scenario. So mention that. Okay. That's what I meant for. Okay. So we have done with that. I think next setting is hospital ward. Something really good and so good go with.
Another important is hospital ward. Another setting is hospital ward. So what can be done there? How can we start in a non-case? Hospital ward and a non-case. You know the patient, and the setting is a hospital ward. How could you start a conversation? You could say, how are you? How are you doing today? Because the patient is known, right? You could just say.
See, simply, if you are, everyone is nurses, right? If you're into the room of the patient on a particular day, that you're gonna meet the patient for the first time on a day. So what are the things that you are asking to your patient? There are a lot of things like you're gonna inquire about have you had your breakfast, how was your sleep yesterday, and what about your routine, and are you happy here? How you're feeling?
Okay.
Kind of questions. Okay. Why don't you go for that then?
Okay.
Okay. So this is kind of thing. See, it's a non-case, and it's purely clear that we know the patient well.
Okay.
Okay, so we can start our greeting with the name of the patient. It is always better to start the greeting with the name.
Okay.
Okay, so kind of this. Good morning, Vipin. As you know that I'm your assigned nurse, I'm Varna.
Okay.
Or I'm gonna assist you today, I'm Varna. Kind of. Okay. Then go for that. How is your day so far?
Okay.
Have you had your breakfast?
Yeah.
How are you feeling now?
Okay.
Kind of questions.
Just inquire about his, his well-being. So basically, you ask the well-being. Have you had your breakfast? Have you had a sound sleep yesterday? Okay, how was your previous night? Did you get a sound sleep? So you could just inquire about it. Don't ask all these one. Just ask one of them. Okay, fine. So community health center, there is unknown case coming in. So it is a community health center, and the patient's name is the name of the patient is Peter. You had never seen whom Peter in your life. You're meeting Peter for the first time.
Yes.
So how will you put it?
If it is the first time, definitely it's an unknown case,
Yeah.
right? So go for the same kind of normal introduction. Good morning. I'm gonna assist you, or I'm gonna take care of you today.
Okay.
What's your name, or for the documentation purpose, may I know your name, please?
Okay.
Before that, you can go for very basic things. Take your seat. Fine.
Yeah.
Go for, because it's a center, you're gonna meet your patient. So after our introduction, you can say, or after good morning, you can you can ask them, take your seat. Then go for your introduction, whatever it is. Just try to put as so natural with the setting.
That's
okay.
right. That's right. So I think we are done with that part as well. It's almost 45 minutes. We are taking this live with the last scenario of a post-operative ward. Post-operative ward. Simplify it. Post-operative ward. How will you say situation? Always post-operative ward can be what?
It is something really bothering, and they will be concerned about their condition. They have in my pair relatives.
Yeah.
Okay. So they need an hope over there.
Yeah.
Kind of, because they're done with the surgery. So definitely it is something, an expectation or hopeful stage.
Yeah.
Okay.
Okay.
So
they are after a surgery or after a medical condition, all beep sounds, and they are inside an ICU or something, but they have a lot of expectation of getting back to normal life. There is a worry existing in that room.
Yeah.
So as a nurse, you enter, you put it in a real situation, you will understand how the feeling of it. Then you do this role play. I'm damn sure that you will get 400. Okay, fine. So how will you put it?
say good morning, Jack. Good morning, John. Or whatever it is. Okay. I hope that you are doing well. I hope that you are getting better.
Okay.
I hope that you got sound sleep yesterday, whatever it is. But it should be a word. If it is hope, that it is something so pleasant to hear.
Okay, fine.
Okay. So you don't go for the normal talks and go for the task of yours.
Yeah, that's right.
So then,
so if there is any doubts or clarifications that you want to make, we are available. You could just comment it. We'll be seeing through.
yeah, sure.
There are some general things also that we could state. We will be stating there as well.
If you do have any doubts, just please show to here in the comment box. We will go with that.
Okay. More you study. Okay. Okay, Anu Krishnan commented, more you hear, more you study. Oh, that's really right. So I used to tell my students, please do listen to some, English movies first with subtitles. Watch the same movie without subtitles. That will give you an intonation that will help you in your listening as well. So when you speak, those things can come back to your mind. Your mind is always tricky, so it will come back to you. Okay.
Okay. Ajra is asked me, and one more student is asked me about, can you show some kind of empathy on reassurance words or kind of situation?
Please go for that.
See, if it's some kind of parents, if you're talking to parents, you can tell them that being a mother, I can totally understand your feelings. Okay. Or if I were in your place, I will feel the same. Okay, kind of things.
Okay.
And reassurance, try not to worry. You are in the right place, and we are here to help you. And if they are more concerned, or they are overwhelming about their condition, you can tell them that we do have an expert panel of team here, and we have done with lot of surgeries, and we do have a lot of success stories.
Okay.
And try not to worry. You are in the right place.
Okay.
Then your worries are totally understandable.
Fine,
It is
fine.
hard to learn, or it is hard to hear,
Yeah.
kind of things.
Okay. I hope that doubt is clear. Another one is another one from somewhere north side. The sound feels deliberately making. How to do it in a natural manner? That's a good question. Very often people, let's take a simple sentence in English. I want to say the wall is white and beautiful. Okay, I think I have mentioned this example in the class as well. The wall is white and beautiful. This is an English sentence. You want to say this sentence: the wall is white, it's beautiful. That part you forgot. Okay, you forgot the second part. The wall is white, you have that. After that, to remember it is beautiful, you will make the wall is white. You make all these noise.
It is called as humming.
Yeah,
Okay.
it's called as humming. So what shall we do about that? So there you must learn some fillers, so gap fillers, like instead of making this sound, you could just say the wall is white. You know what I was trying to say was it is beautiful as well. The sentence is clear, right?
We are actually putting some tricks to complete that or to hide that actually.
Exactly.
But don't be silent and don't think about that. If you're closing your mouth and if you're thinking about that, the sound will be there. And
Yeah.
don't, the students are always complaining, ma'am, we do have humming. Okay, we do have humming. Okay. So try to note, like, if you practice English, definitely there is nothing to be done with that. You have to practice English. Okay. Do for daily speaking. Like more than role play, you have to speak with yourself. Kind of doing kind of a daily practice. And don't focus on to reduce your humming. If you're focusing that, it's going to be increased.
Please don't bother about that. The more you practice English, and one thing is that if you see Europeans when they speak, they do have humming. They do hum. Humming is not harmful. Okay, it's like you can hum, not in an excess manner. Okay, it should not be a pause and making sound. It should not be that. When you are saying the wall is white, yeah, it is beautiful as well. It's a normal way of saying like, that humming is okay. That's completely fine. But it should not be it should not take a long gap in between. That's what we are meaning. So learn some gap fillers, like perhaps, in fact, what I was trying to say was, yep, you could add all that, and those hummings can be rectified. Okay.
And Neha asked me, can we use hum as like response? Yes. Okay. It is called as humming signs or kind of humming words or humming sounds. Okay.
Yeah.
It is not actually humming. Okay. See, like if, because we are recording your role play for assessment. The interlocutor does not play any part in assessment. I think everyone is clear with that. Okay.
Okay. Fine.
Okay. So what is, if the if you want to show that you're listening them and you're communicating with them throughout, you have to go for like a lot like kind of sound. I'm not telling to sing a song like It is kind of this kind of humming words you can be used about that, but should not be so bad. It kind of here Vipin sir did now, kind of okay. And you can nod like this, okay, then I'm nodding is yes. So kind of words you can you can use to fill that.
Okay. I think almost we are done with. We'll complete by saying just one more thing about when we speak about voice modulation. Very often some students do come in, they say good morning in one tone. When say towards the end, get well soon, the tone of will be same from the good morning till get well soon, or saying thank you. It will be same. There will not be any modulation. So for that, it's like put it this way. When you are making some statements from the perspective of medical science, let that have a higher tone. Okay, when you are sympathizing or empathizing with the patient, you can have a lower tone. For example, a statement that you are saying from the perspective of medical science, like before traveling to Cambodia or Vietnam, you are expected to take the vaccine for hepatitis A and B. This is a statement which is very solid and strong from the perspective of medical science. That should have a higher tone. So when a patient is saying, My son passed away yesterday. As a result, I collapsed. That's why I'm here. So you're going to sympathize with this patient. Your tone should not be higher. Let it bring down. I'm so sorry to hear that. I hope things will get back on track soon. You have a lower tone. That's how we modulate our voice. Just don't give a big thinking about it, but just keep it back of your head. That will be beneficial. Okay, hopefully.
It's clear now.
Okay, hopefully it's clear. Okay, fine.
See,
Okay, good.
during
Any other
home
doubts?
visit, if we are talking to, it is by renter, talking to a third person, how to start also without patient, how to start also without patient presence. Okay, probably if you are talking to the third person in home visit, it is not actually seen much, but if it is you are talking to a third person, you can go for like this. It's kind of, if you are like during the clarification, because we know that we're gonna visit the patient, right?
Okay.
We know the name of our patient, so just ask, is it Peter's house? So they're gonna, oh, I'm talking to Peter. They will tell that no, I'm not. Okay, so you can ask like, for better communication, may I know the name, or it will be given in the background. You are talking to the bystander of particular patient, like mother of, you're talking to the mother of the patient, kind of. Okay, kind of. So just ask, is this Peter's house? You can ask for that. It is Peter's house. So may I know whom I'm talking with?
Yeah, you could just clarify whether you are talking to the right person or even. Okay, fine. Hopefully you got it. Any other doubts or clarification? So please don't lose hope and continue to study well. This is gonna be easy. It is not a hard mountain to climb, but people have done it previously. You know, your predecessors have done it. Now it's your turn, and your successors will do it as well. So now it's your turn. Study well and practice more. Okay, develop a English culture. Okay, whatever you see, the series that you watch, the movies that you see, let that be English. Let English revolve around you, and when you go for listening or speaking, that's just a cakewalk for you. I promise you that. Okay, we have made it that way. Okay, it's a bit hard to make, but still through practice we could make it out. Do you want to make a comment?
Yes, I just want to wish all my students all the best, and I think that speaking is not a hard thing. See, all the thing is really concerning the students is they are talking to a person. Okay, that's the reason. Okay, see, all the 3 modules they are doing with by their self, all the listening, reading, writing, and but the speaking, it is something really bothering, that they know that they are talking to a person and he or she is well known with English. Okay, so students, the one is sitting opposite to you is to help you to complete your role play, not to judge you or to assess you.
That's why he is known as, or he or she is known as interlocutor, a facilitator. They are just facilitating to complete your exam. They are not gonna give you mark. They will not give you. They have no authority over giving you any grade A, B, or C. Nothing. So it's altogether another process. He is there to facilitate to complete your examination. That's the thing. That way, okay. Fine. I hope we've done it.
I think that we're done with that. I just like the question if you're talking to the third person, if in the home visit. So go for that. Like kind of go for that. I'm talking. Is this Peter's house? May I know whom I'm talking with, or for better communication, may I know your name, please?
Okay.
Done.
Fine.
Okay.
Okay,
so shall we wind up then?
We'll wind up by saying a good news once again. Another drive, German drive coming up in Kottayam branch of AJINORAH. It's a direct interview from the direct delegates who are coming and taking this interview. It's going to be on 23rd of this month. Please be present there. Please, all the nurses are welcomed over there. Please to come utilize this opportunity as much as you can. It's gonna be starting by 9:30 and we'll be winding up by 4:34. Okay, you are welcomed, and we would like to once again congratulate all the OE team.